Hello guys, welcome to Examdays. So in this video I'm going to discuss about 18th MLHP entrance examination bits, which is very important for the examinations. So today the first question is going to be: the patient has cleared the fluid leaking from the nose following a basilar skull fracture. The nurse assesses that this cerebrospinal fluid, if the fluid is options is going to be your option C is cleared and the test a negative glucose. Option B, the grossly fluid in a appearance and has a pH of 6. Option C, clumps together on the dressing, has the pH value is going to be 7. Option D, separate into concentric rings and the test positive for glucose. The correct answer is going to be option D, separate into the concentric rings and the test positive for glucose. Next question: the nurse is caring for the client who begins to experience seizure activity while bed. Which of the following actions by the nurse would be contradicted? Option A, loosening restrictive clothing. Option B, restraining the client's limbs. Option C, removing the pillow and raising padded side rails. Option D, positioning the client to the side if possible with a head fixed forward. Correct answer is going to be restraining the client's limbs. So this is very important questions. Next, a focal neurological deficit lasting less than the 24 hours. Once again, the question is going to be the focal neurological deficit lasting less than 24 hours. That's going to be a stroke or stroke in evolution, C, TIA, and the final option is going to be hypertensive crisis. Correct answer is going to be TIA. Moving on to the next question: an important post-operative care for a patient undergone step-ectomy. Once again, an important post-operative care for a patient undergone step episiotomy, which means we have to check the options first. Check gag reflex, and B, encourage independence. C, instruct is patient is not below the nose. Final option is going to be D, which is position the patient on the operative side. The correct answer is going to be instruct the patient not below the nose. So which is very important for the post-operative care for the patient. A patient is admitted with severe muscle weakness in the hospital. A patient is admitted with severe muscle weakness in the hospital. The doctor diagnoses with GBS. What is the characteristic features of GBS? So here is the question is: the patient has been admitted into the hospital for the muscle weakness. So the doctor has diagnosis with GBS. So here is the question is asking what is the characteristics of GBS? A headache. Option B, diaphoresis. Option C, ascending weakness that begins in a lower extremities. Option D, hypertension. So what is the correct answer? You have to answer this question. So very easy questions as the characteristics of GBS. The answer is going to be headache. Next question: poultice or cataplums is a method of what? Options: A, dry heat application. Option B, moist heat applications. Option C, dry cold application. Option D, moist cold applications. So the correct answer is going to be moist heat applications is a method for poultice or cataplasm. Moving on to the next question, which is important for the temperature side. The question is going to be temperature of water used for tepid sponging is what? Temperature of water is used for tepid sponging is what? That's going to be is given 4 options, which is the 65 to 90 degrees Fahrenheit. Option B, 50 to 65 degrees Fahrenheit. Option C, 85 to 100 degree Fahrenheit. And option D, 100 to 115 Fahrenheit. So your answer is going to be what? The correct answer as given as 85 to 100 degree Fahrenheit is the temperature of water which is used for the tepid sponging. Next question. Complex partial seizure usually associated with the complex partial seizure usually associated with option A, frontal lobe, B, parietal lobe, option C, temporal lobe, and option D, occipital lobe. And your answer is, the correct answer is going to be temporal lobe. Next question. So in this question we are going to concentrating on colonic irrigations. So the complete question is going to be, which of the following is not a contradiction for colonic irrigation? So the question is going to be, please understand, which is not. We are asking which is not a contradiction for the colonic irrigation. Option C, fistula in anus. Option B, bleeding hemorrhoids. Option C, carcinoma rectum. Option D, hyperpyrexia. So the correct answer is going to be which is not contradiction for the colonic irrigation, which is hyperpyrexia. So next question. Nurse is aware that extremely depressed clients seems to be the best in sitting where? The nurse is already aware that extremely depressed clients seems to do the best in sitting, whereas the correct answer, you have to identify the correct answer where actually suitable answer for this. Your options are multiple stimuli. Option B, routine activities. Option C, minimal decision making. And the final options is D, is varied activities. So in this question, the nurse is already aware about most the extremely depressed patients, which we call as the clients, which seems to be the best to do in the setting where. And your answer is, the correct answer is going to be option B, routine activities, as the best to do the extremely depressed persons. So here is very important questions. Okay. So next question. The language development in autistic child resemble is what? So options are scanning speech. Option B, speech lag. Option C, shuddering. Options D, echolalia. Correct answer is going to be echolalia. Echolalia is the language developed in the autistic child resemble. Next question. The average duration of viability of sperm is the duration of viability of sperm is option A, 12 hours. Option B, 24 hours. Option C, 36 hours. Option D, 96 hours. So what is the duration of viability? That is going to be average. So make sure that you have to understand the word average duration. The correct answer is going to be 36 hours is the average duration of viability of sperm. Next question. The minimum length of cord to be left behind after delivery is. The minimum length of cord to be left behind after delivery is. Option A, 5 centimeters. Option B, 2 centimeter. Option C, 8 to 10 centimeter. Option D, 12 centimeter. So the correct answer is going to be option C, 8 to 10 centimeters is the minimum length of cord. So guys, these are the questions which we covered under the 18th part. So you have to like the video, share the video, and don't forget to subscribe for Examdays TSAP for more videos on MLHP entrance examination bits. So these are the bits very important for the examination. You have to try to focus on the important topics where every year these topics are frequently asked. So in this topic, various questions are generating based on the subject. So in the next video, we will discuss with new topic and new questions. Thank you for in this video. We will meet in the next video for more information. Thank you.